Today we're going to talk about gouty arthritis. Now, gouty arthritis is quite a common condition affecting the Asian population. Usually the patient would present with very painful big toe. They would, out of the blue, without any history of an injury, gradually they get the toe becomes more and more painful, to such an extent they can hardly able to walk because of the pain. They often wonder why the pain is so painful without any injury, any history of an injury. They may previously have had similar attacks in the past, and then gradually it subsides. Now then, some patients may be presenting with this condition for the first time. Now, apart from the big toe, it can also affect many other joints, including the ankles, the forefoot, and sometimes that affects the knee as well. Now then, in this condition, there is a buildup of uric acid or urate in the joints, and this is a result of high level of uric acid in the blood. In these individuals, there is some problems with their metabolism, such that they're not able to remove the uric acid in the blood so well, such that there is a high buildup. Many of the times they may eat very similar diet to that of the other members of the family, yet they themselves may be the one that's having this particular condition. Now then, gout is problems with the metabolism of the uric acid. It is a purine metabolism pathway problem. In that individuals, the main problem is being this particular enzyme known as the xanthine oxidase. Now then, in these individuals, they may present with pain to many parts of the bodies, including the ankle, the toes, and in some cases the knee as well. Now then, the person who presents with this particular conditions, the joints will look very red and swollen, and the skin looks very shiny. And the most characteristic feature is that the joints, the skin looks very shiny and it feels very warm. Now when we palpate the joint, it's usually very painful. When you press on it, the patient will feel a lot of pain to that area. We almost describe this as exquisite tenderness to the joint. By the time I see the patients with these kind of problems, usually the patient will have quite a lot of symptoms already, and usually I would treat these patients with an injection to the joints, and that will certainly alleviate the symptoms in a lot of instances almost immediately. So injection is certainly beneficial. However, in some patients where the symptoms is not so bad, it is possible to treat this with medication. These would include anti-inflammatory medicines such as Celebrex or Coxia, and together with taking regular colchicine as well. Colchicine will certainly help to reduce the acute reaction of the bodies to the high uric acid. Usually this will solve the problems. Now then, once the acute phase has passed, the patients would require to lower the uric acid by taking regular medicine known as allopurinol or Xyloric, and this will help to lower the uric acid. But of course, diet would also help to lower the uric acid. Now then, what are the low uric acid diets? Well, I think there are quite a lot of literature in the internet, but essentially the main things to avoid would be to avoid nuts, beans and lentils and seeds. These food substances will have quite a high uric acid. The second group of food to avoid in order to lower uric acid would be the pigmented food. By that I mean avoiding red meat, red wine, and even things like salmon, and that would still be regarded as a form of pigmented red meat. red wine should be avoided. So in summary, the way to control the high uric acid for patients with frequent Gaudy attacks would be to control it either by diet means or supplement with medicine, including probenecid or allopurinol. Now, it is important in the long run to control the high uric acid because it can cause quite a lot of damage to the soft tissues. Essentially, these high uric acid will be accumulated in the soft tissues, and that would result in damage to the soft tissues. Now, in case of the joint, particularly so in the knee joints, high uric acid can damage the cartilage inside the joints, and that would result in osteoarthritis to the knee. Now, the bunion is quite a common problem that we see in our clinic. It is characterized by the big toe pointing away from midline, and that the patient also complains of a prominent lump at the one side of the toe. And that here we see that this is a typical picture of patients with a bunion, otherwise known as hallux valgus. In these conditions, some patients may complain of pain to the inner side where the lump is rubbing against the shoes. The patient may complain of the deformity as well as pain to this area, and they find difficulty in finding suitable shoes because it's often wider. Now then, how do we, there is a familial tendency in that parents may have this kind of problem. It does tend to affect ladies much more, especially those who wear very tight pointed shoes, and high heel also tend to make the condition to be worse. Now then, diagnosis is often not a problem, but the treatment wise, one can treat this either conservatively or surgically. From the conservative treatment's point of view, it is important to pull the toe inwards as much as possible. That will help to stretch the soft tissues such that it doesn't get pulled away from the midline. Other than that, there are various different orthoses or prostheses that one can wear, and you can buy these from the pharmacist. But a lot of the times it's difficult to discipline oneself into wearing these, and it's often very impractical. So in most cases, the treatment for correcting the deformity often requires a surgical procedure. And in this procedure, one would involve in creating some traction on the inner side of the capsule. The lump is then removed, and then the bone is realigned such that it's no longer pointing away from the middle. If the patient complains of pain to the inner side, sometimes we can treat this with an injection, and that will certainly alleviate the pain. Whereas in most cases, the treatment can only really be treated surgically.